All right, today we're going to dig into a real medical head scratcher. It all starts with something super common, a sore wrist. But this is no ordinary sprain. We're talking about a condition that can seriously stump doctors and leave patients wondering what on earth is going on, because it's so good at hiding. So let's jump right in and start unraveling this mystery.
So here's the question that kicks everything off. And believe me, it's a frustrating one. You're asking yourself, why does my wrist hurt so bad when the x-ray is totally normal? You feel it, right? The pain, the weakness, the stiffness. You go in for that x-ray thinking, finally, I'll get some answers. And then, nothing. It comes back clean. Well, that exact moment of confusion, that's where the story of Kienbock's disease really begins.
Okay, let's open up the case file and look at the evidence. What are we dealing with here? Well, you've got this persistent, deep ache in your wrist. There's some swelling on the back of it, it's getting stiffer and weaker by the day, and you're even having trouble turning your hand upward, like to accept change. But the real kicker, the big clue, is what's not in the file. Any problem on that first x-ray. This combination, real obvious symptoms but a totally normal-looking x-ray, that's the classic signature of what we're hunting for.
So that normal x-ray, it's kind of a dead end, right? It means our investigation has to go deeper. We need to start looking for clues that a standard x-ray just can't see. And this is where we really start to zero in on our prime suspect.
And here it is. The culprit is Kienbock's disease. Now I know, the name sounds a little intimidating, but the idea behind it is actually pretty straightforward. It's a type of avascular necrosis. Avascular means without blood, and necrosis means death. So you put it together, bone death due to lack of blood. And in this case, the victim is a tiny but super important bone in your wrist called the lunate. It's basically being starved of its blood supply. And without that, the bone tissue just starts to die.
So to really get why this is such a big deal, we have to look at the lunate itself. It's this little C-shaped bone, kind of like a crescent moon. That's actually where it gets its name, from the Latin word for moon. And look where it sits, smack dab in the middle of the wrist. Think of it like the keystone in an arch. It's the critical link between your forearm and your hand. This central spot is what makes it so important for all your wrist movements, but it also, unfortunately, makes it really vulnerable.
And where did that name come from? Well, it's named after Dr. Robert Kienbock. He was a radiologist in Vienna way back in 1910, when x-rays were still this brand new, amazing technology. He was the one who put two and two together. He didn't just see some weird shadows on an x-ray, he actually tracked patients over time and described the whole journey of the disease. He basically drew the first map for this condition, which is pretty incredible.
So you might be wondering, who usually gets this? Well, surprisingly, it's not something you typically see in older folks. It usually hits people right in the prime of their life. Think 20s, 30s, 40s. And it tends to show up in your dominant hand, which makes sense, right? That's the hand that does all the heavy lifting and gets put through the ringer day after day.
Okay, now for a really key clue that has to do with your anatomy. It's all about the length of the two bones in your forearm, the radius and the ulna. For most of us, they line up pretty evenly at the wrist. But for some people, the ulna bone is just a little bit shorter. That's called negative ulnar variance. Now, why does that matter? Well, that little bit of a length difference completely changes how forces are distributed in your wrist. It basically puts a squeeze on the lunate, putting extra stress on it with every single twist and turn. All right, so if that first x-ray is a total bust, how in the world do we actually solve this case? Well, the answer comes from a huge leap in technology, something that lets us see what Dr. Kienbock could only dream of seeing. We're not just looking at shadows anymore. We can see the health of the bone itself.
And this, right here, is the aha moment. Just look at this. On the left, you've got that perfectly normal-looking x-ray. You can totally see why this gets missed, right? But now, look at the image on the right. That is an MRI of the very same wrist. See that dark spot on the lunate bone? That is the smoking gun. It's the clear sign of avascular necrosis. The MRI can see that the blood supply is gone, long before the bone even thinks about collapsing. So I really want to drive this point home. The MRI is absolutely the key. It is the tool that unlocks an early diagnosis. And catching this thing before that little lunate bone collapses, well, that changes everything. It's the difference between treatments that can actually save the bone and much bigger surgeries on a wrist that's already in serious trouble.
Okay, so now that we know it's Kienbock's, the next big question is how bad is it? How far along is the disease? The investigation now shifts to figuring out the stage of the disease, which is critical for figuring out the right game plan.
The go-to system for this is called the Lichtman classification, and it's based on what you can see in x-rays. So, stage 1,
That's our original mystery. The X-ray looks fine, but the MRI knows the truth. In stage 2, you start to see changes on the X-ray. The lunate looks brighter or more dense because it's dying. Stage 3 is when things get serious. The bone structure gives out and it starts to collapse and fragment. And by stage 4, well, that collapse has thrown the whole wrist out of whack, leading to some pretty nasty arthritis.
But you know, pictures can only tell you so much. To really understand the health of the cartilage, that smooth, slippery lining on the joints, surgeons often want to see it with their own eyes. So they'll do what's called an arthroscopy, where they put a tiny camera right inside the wrist. It gives them this incredible up-close view. What you're seeing here is exactly that, a crack in the cartilage that they found. Seeing this kind of damage helps them get an even more precise idea of the stage and map out the best possible surgery.
All right, now we get to the part everyone wants to hear. What can we actually do about it? Now that we have a diagnosis and we know the stage, we can finally make a plan. And the key thing to know is that there's no single cure for Kienböcks. The treatment is totally personalized, matched specifically to how far the disease has progressed.
This chart basically breaks down the game plan. If you catch it early, in those first stages, the goal is all about protecting and healing. We want to unload the joint, maybe restore that blood supply, and give the bone a fighting chance. If things are a bit more advanced, the goal shifts to reconstruction. We're talking about procedures to rebuild the wrist. And then in the really late stages, when arthritis has set in, it becomes a salvage situation. The goal there is to get rid of the pain, even if it means losing some of the wrist's motion.
So let's look at a really cool procedure for the early stages. It's called a vascularized bone graft. It sounds complicated, but here's what happens. The surgeon takes a small piece of bone from your forearm, but, and this is the amazing part, they keep its tiny little artery and vein attached. Then they transplant that whole living piece of bone into the dying lunate. It's like plumbing in a new blood supply, giving the bone the resources it needs to heal itself. Just amazing.
But what happens if the lunate is already too far gone to be saved? Well, for those middle stages, one option is to just replace it. This X-ray shows an implant made of a special material called pyrocarbon. It's shaped to be a perfect stand-in for the original lunate, filling that gap and letting the rest of the wrist function much more normally.
And finally, when we get to the most advanced stage, stage 4, the #1 goal is just getting rid of the pain. And one of the most effective ways to do that is with a total wrist fusion. You can see it here. They use a plate and screws to basically lock all the wrist bones together into one solid piece. Now, there's a definite trade-off. You lose the ability to bend your wrist, but for many people, getting rid of that constant, grinding, arthritic pain is absolutely worth it.
So after going through this whole medical mystery, from the first confusing symptoms all the way to these incredible surgeries, what's the one thing you should take away? It's this. A high index of suspicion is everything. If you have a younger person with that stubborn wrist pain and a normal X-ray, you've got to think about Kienböcks. Getting that MRI early isn't just the next step. It's a move that can literally change the entire outcome for a patient. And that kind of brings us to the future, and a final question to think about. I mean, look how far we've come, from just seeing shadows on an X-ray to literally transplanting living bone with its own plumbing. The next big leap is probably going to be biological. So can we, one day, find a way to step in even earlier, to use new therapies to convince a bone's blood supply to just regrow before any real damage is done? That's the big question, and the answer will be the next chapter in the story of Kienbock's disease.